Okay, you need to have the, make sure they don't have a bra that's going to be too low. Okay, probably, yeah, there are patients that have bras with like 5 hooks in them, and they come, or they just come down real low. So just make sure, just check where their bra hooks are. Some people have corsets on nowadays. Okay, there's a lot of those. All right, and you don't want to have to do it and have like all these hooks running through it, and you have to redo it, or have it just show up in L1. Because guess what? You have to redo it. Okay, so always check their hooks on their bra, where the bra, the back of the bra is. They don't necessarily have to take it off, but if you have any doubt as to whether or not it, is going to be completely out of there, just, hike it up their back, right, and kind of check it as they lay down to make sure it stays up there. Okay.
Where does L1 normally start?
It's going to be like right in here. Well, right, like kind of belly buttons, a little bit right around belly button. Yeah, a little below the ribs. But you get some patients that are very short. They're going to have much more compacted everything. Okay, so their bra hooks are going to be lower. Okay, and that's going to be more often on your much older patients. Okay, ladies, which is going to be a lot of the time who you're going to be doing these on. Okay. Also, belly button rings, no. If they have it in there, they gotta take them out. Okay, that's gonna be right in your lumbar region, right in the middle, whatever vertebrae it ends up being, usually around L1 and L2. Okay, so they gotta take it out. You pretty much have to ask people that. Okay, and it's starting to be, it's used to be you could kind of think, just younger people, but there are a lot of middle-aged ladies, probably more middle-aged ladies nowadays that have the belly button rings than younger ladies. Okay. What else? Panties. Okay. There are a lot of panties that have crystals and things on them. Okay, and or they'll have like a little charm in the middle, and they're cute. The problem with that, even if you ask patients, they'll probably automatically say no, but they don't remember what was on their panties when they put them on in the morning. I can't tell you how many times I've seen that happen. So just because you ask them and they say no, doesn't always mean that that's the case. They just might not remember what they've got on their pants, but at least ask them again, especially with younger. You kind of know what people who might have little fancy little panties and who's gonna have, I mean, come on, just being real with you guys. Okay. Also pants. If they tell you, okay, I've got sweats on. All right. Now, I don't know. Sometimes in the hospitals, are you having patients take their pants off just automatically? Take everything off from below, or no?
It depends on what band. If most of the people that we do lumbar spines on are already in their gowns.
Okay, so that's so good. So then you don't have to worry about their pants.
If they don't have any metal on them, we let them keep it on.
Okay.
So tights and sweats
should be okay, but sometimes people have sweats and they don't realize there's the little grommets in there. Okay, so check for that.
We usually do have them take it off unless, for some reason, they can't undress themselves. Then we'll have them pull it down or whatever.
Okay. So and in the hospitals that's going to be the case. But if you happen to have a patient, if they come in, you're taking them like off the street, they're coming in because they have a script or whatever. Just check out and make sure if you're not, especially if they say they have sweats on. Most of the time they're okay. Also be careful of if they have sweats or leggings or whatever that have like a reflective kind of writing or something on them. That will show up. Okay. So just be aware of all that stuff. Okay. your patient to be lying in the center, so just scoot up just a tiny bit, or scoot over teeny. Okay, good. Also, whenever I do anybody, I kind of line, if I know what body part I'm doing, which you should know, because you'll have a script for it, you know what you're doing, kind of line the setup to like where it's going to be within the body. Okay, you don't want it for a lumbar all the way up here, but if you were doing, like last week when we were doing your T-spines, help yourself out. Always bring your bucky tray all the way up for your T-spine, okay? If you're doing something on, femur or something down here, knees, always do bring your cassette, your bucky tray all the way down to the bottom, okay? So just kind of keep that in mind, like, kind of get it set for based on what you're doing, okay? All right. Yep. Also, markers. When I do my L-spine, I put my markers like right in here. Okay. Come off of center, like about halfway between center and the other side. So I put it like right in here.
Like 2 inches in, right?
Mm-hmm. Okay. And then you can put that in when you know you have this line up and your tray in there, and you don't have to touch anything, okay? Okay. All right, so you're gonna feel, hopefully you'll have a patient that's like this. And you can feel that ACEs right there. Boy, that's awesome. Okay. You can see them, yeah. Like, especially if they have tights on her, but it's like, oh, I don't even have to touch you. I can just do this. Okay. So that's awesome. A lot of times it's not going to be the case. Most of the time. So don't be afraid to be, you don't manhandle your patient, but be firm with it when you're feeling in there for that, okay? Especially when it's a bigger patient, okay? And don't be embarrassed. I know you kind of will feel that way, but try not, you're just trying to do your job, and it's not your fault if you're having if it's not clearly evident like this, okay? So just also when you're feeling up and around, because what you're trying to do is come around to that crest. And you can kind of feel how it goes all the way around, right? Sorry if I'm poking you, okay?
No, you're fine.
Also, you might have a patient who's very ticklish. This is hard to do if they're very ticklish. Usually they'll like giggle, the first couple of touches and get it out of their system, and then, then you'll be able to kind of do it, right? And if not, if you absolutely, they can't handle it, just know that the crest is going to be like 2.5 inches or so above where their
You can ask them to point to their belly button, right? And that's like
belly buttons, especially if it's not the best way to gauge where things are, especially if you've got a bigger person with, much more extended stomach. Belly buttons kind of end up all over the place. Okay, so not the best.
You are right. Some people
gauge for that.
Supposed to be.
Okay, so as long as you can feel for where ACEs is, then their crest is going to be about 2 inches, maybe 2.5 inches above that spot, okay? So if you really can't, and sometimes what's the hardest people to go up and find their crest are muscular guys. Because there's so much muscle there, you can't really feel the difference between what's muscle and what's bone, what's crest. Okay, so they're the hardest to feel that on, and you're like, oh. Just trying to find your crest. And then if, like you say, it's because you're so muscular, they're like, well, they're like, okay, feel away, Oh, never mind. Sorry. But really, I'm kidding, but I'm not kidding, okay? All right, so you find that eventually you will be able to just kind of gauge, look at a person, kind of feel where their ACEs is, and you won't have to touch them any more than that. You'll just kind of know, what you need to do or where you need to get. Because remember, we're looking for lumbar spine. We're on a 14 by 17. kind of hard to like completely miss the boat, right?
True.
Okay. So always keep that in mind too. Like if you ever start getting nervous or flustered or whatever, just again go back to our anatomy. How many inches are we talking about that we're really trying to see? Right? 6 inches, 7. We're on a 14 by 17. Okay. So just remember that. All right, and just so don't get, you know, because I remember when I was first doing this, I'd see a really large, like 300-pound guy. You're like, oh, how am I going to find, you know, it's in the same spot, you know. It's like right going to be right in the middle. So make sure you're in the middle. You know, make sure you're going to be like, you can kind of usually, even on a large patient, sort of see where the rib cage is, and you can gauge that. I mean, you can see how where, you know, look on this person, where the ribs, okay? Where's their L spine from their ribs? Oh, right below it. Okay, you're going to be able to see this part at some point on most people when they're laying down. Okay, so just kind of use that as, you know, gauge that. That's probably going to be around L2-ish. All right. Make sure you get it. So, you know. All right. So just always go back to that. Always, always, always. Okay. All right. Why are we so little here? Did I not?
Is it on table?
Let me see. It's on table. Yes, it is. All right. So what else is wrong? Oh, there we go. Still saying exposure hold though.
Are you in the middle of the table?
I might not be this way. Up. Right. There we go. Good. Okay. Oh, shoot. Sorry. All right, now I always look down the end of the table at my patients to make sure A, that they're straight. I want them straight, and that B, I'm lined up to the center of them. And don't go by clothes, because clothes can be deceiving. You know, because if you see seams and stuff, they can be off, they can be going at an angle, they can not be in the center, so don't go by clothing. Always come down and look at your patient, okay? It might take you an extra, 15 seconds to do that, but it's worth it, okay?
We didn't need to flex her knees?
We're gonna do that. Here's the shield. I wish I had a littler shield. This is a lot to put. Right like that. Okay. There we go.
Good job.
Okay. All right, so so next, all right, so now you're going to take the sponge out. I'm going to have you bend this knee up, bring this arm across. Roll. Now, see, she just shifted. Did you see that? Mm-hmm. Okay, that's what we don't want them to do, because it totally just she went kind of that way. Mm-hmm. All right, so her spine is now not nice and straight. So what you want to do is have them do that, put this under, and you roll them, okay? And then have them lean back against here. Come up a little bit. Mm-hmm. Okay. Now, you should still hopefully be able to feel where that crust is, okay? For this one, we're going to be a little bit above that.
1.5 inches above.
1.5 inches. Now, it's a good idea. I know it sounds kind of silly, but measure your finger, okay? see how much 2 of your fingers are, how much 3 of your fingers are, how much 4 of your fingers are. So you have an idea of what's 1.5, what's 2 inches, what's 3 inches. So when we're doing things that are 2 inches below or 2 inches above or 3 inches or whatever, you can use your fingers and say you got a good idea of what that is, and just so you don't have to, like, you know, it's just a quick measuring thing, right? And your patient doesn't necessarily know you're doing that, okay? So just know what. So for me, like 3 of my fingers is like, you know, a little bit, is like close to 2 inches. So if I go a little bit less than that, I know I'm right where I want to be. See, right like that? Yeah, you can't see it so well because, but a little bit less. Okay, so I know I'm about 1.5 inches. Okay. Also, again, since there might have been some shifting of your patient's body and that getting oblique, always come and look down here. Make sure they're nice in a nice straight line, okay? She put her arm in a nice spot. Thank you. Legs are good. Nice 45-degree angle. Okay, I got her where I want her here. Now, again, this is one that's going to seem tricky to you too. Some techs will say, okay, you can look down their ear and use that as word center, that line. Oh, what the heck? Okay. It's going to seem like you're not getting her spine, okay? And you can also, now we know we don't have L spine up here. This is why we used to be able to do these on a smaller cassette. We'd switch down. I always just kind of still look at where they're, from their neck, you can kind of gauge where their spine is going down, okay? Just kind of follow that down and make sure you got that in there, all right? Markers on this one, you do have to be anatomically correct, so you might feel like not as comfortable just leaving your marker in here. So if you want to like put your marker up here, that's okay. All right. And which marker would we be putting there? Left, correct. Okay. It would be very dicey putting a right there. I wouldn't, suggest it because you're likely getting it in the spine there. Okay, but over here you should be okay. All right. And I had that probably collimated a little bit tighter than any of you would feel comfortable with at this point, so I'm okay if you're more like that, okay? Just until you get a much better feel, all right? Okay? All right, lay flat. Now we're gonna do the same thing here. I want you to bend this knee up, bring this arm over. Again, you control the patient, bring that under and then bring it back. Now, if she moved like you hope that she moved, pretty much we should be able to just come like that, and you shouldn't have to touch much of anything else, okay? Again, just look down here, make sure you're where you want to be. Again, make sure they're straight. Okay. Yep, I'm happy with that. So again, on this one, an R right here would be fine, okay? All right. Any questions on any of that? Pretty easy. And generally, you'd probably want to do them in the reverse order, what I just did. Start with this one, okay? Wait, no, actually we did do it right. No,
we did it right.
Yeah, we did do it right. Okay.
You did it right.
So do that one first, this one, because then what you have them do is go all the way over onto their left from here, okay? All right. And again, they can bend their knees. She can bend a little bit more on this one. Definitely want to get them perfectly straight up and down. Sometimes I always kind of, how do I do it? I'll hold my patient here and just tweak their shoulders. And the reason why I'm put my hands kind of here is it keeps them from shifting their butt. because more often than not, when you kind of straighten them out and fix their shoulders, they'll move their butt forward or backward, thinking that you want them to move everything. And reality is, no, usually their butt is in a good spot. Then just, if you have to tweak anything, it's way easier to tweak up here, okay? So again, find where ACES is. She's easy, so find that. Actually, sorry, iliac crest. Okay, you want to come a little off of it. Basically, you want to make sure that you got a little bit of light here. Okay, you're gonna bring your lead right up to there. Like, we don't need to have a whole lot of light on their stomach. Why?
That's not what
There's
the
no
spine
spine
is.
there, right? We don't need to. Why radiate all that? All right, so that's why that's also why we're a little posterior. So we don't need to. And so if we have extra light over here, that's not hurting much, especially when we got a mat here. We don't want to have a whole bunch over here. You also don't want to clip the front of your vertebrae either, so make sure you got that covered, okay? And then as long as you have a little, blush of light right there, you'll be good, okay? Where is that little? Now, she's somebody that you might want to take the time to stick this under here. This is kind of a big wedgie though. A big wedge. Like if you have one of the littler ones would probably fit, but she's kind of nice and flat against there. Her spine is looking pretty straight, so I would probably not bother. Okay. You see how she doesn't seem to like be dipping, right? It's when you have a patient that feels like it seems like their spine is kind of dipping down, and you want to boost that up, give it a little support. I wouldn't do it on her. Okay. Now she does have, little waist to her hips. I mean, she's got limit. She got curves. She's
got some curves.
So you can put a little bit of an angle on there. Okay. It's not gonna. And then I always just kind of bring it back to where I started. And usually you end up being pretty close to right where you were. Okay. If you're lucky. So that way, if you do that, okay. Then if you forget to check this, you're still usually okay, all right? So if you put that angle on, just put it on and then bring it back to right where you were, okay? And you should be good. Now you might have to recalmate. Okay. And again, I always like to make sure, I like to make sure I got most of the sacrum in there. A lot of the doctors like to see that. So I kind of you can keep this open so you kind of can check where you are, all right, anatomy wise, and just kind of make sure I like to make sure I'm getting. So what happens? Did I just come off of crest? Yes. But I like to make sure that I have that covered also. All right. Then just put your L right in here. Like you can find, you can either go up here, because is that going to be lumbar?
No.
No. Okay. Or there's usually a little bit of a spot right in here from where their back has a little bit of a curve. You can usually stick it in there. As long as you get the L in there, we're good. You can, most of the time, your initials will all be in there too. Because as long as you're not right on there, you're not going to be in anatomy, because you're not, as long as you're not under her, okay? You should be fine. All right? Okay. So far, so good. Now. All right, so now we're gonna do, I'm just gonna go to the spot. All right, this is the one, we're gonna do 5 to 8. We probably didn't really have to change it, but I'm just gonna change it a teeny weeny bit. I'm gonna feel for where, now she's a very nice person to do this on because we can really feel her aces really well. I usually feel for it with my middle finger and kind of make like a C going right around here, okay? and then I get my crosshairs right, kind of right in the middle of the C. All right, you see that? Okay, make sure we're lined up because I did change that. Oh shoot, now I have to refix that. Collimation's gonna go back in there.
This one should be a 10 by 12, right?
Yep, this is 10 by 12. And when you're on the 10 by 12, I don't have this one in there, but all right, if we're in here like this, okay to put your L like right in here, because how does your coccyx go? It comes down like here and then kind of goes around like that, right? So right there should be like kind of where the ball of your hip is or flesh, all right? Or if you want, you can put it on the edge out here, wherever, you know, whatever you're more comfortable in doing, okay?
What's this? I mean,
or you can put it you'll see a lot of people will put it here or here or wherever. Just make sure you get your L on there, okay? All right. And that should, actually we can come in. Some people, yeah, like you can, like older techs who've been doing this for years and years, they'll like get real small.
Right.
Yeah, real small, okay? Once you guys have been doing it for years, you'll get real small too, okay? All right, so that is your spot. All right, so for sacrum, we're kind of where we are right at ACES, right? Centering at now it's supposed to be like 3 to 4 inches behind there. I'm going to be kind of like off of her butt. If I go 4 inches, you're not very wide, okay? But kind of right in here. Now again, I always sort of look at my patient's anatomy to make sure I feel like I'm getting the entire sacrum in there and coccyx, because really on this one, you're going to be looking, you know, when you do this lateral for the sacrum coccyx, it's for the sacrum coccyx, all right? So you want to make sure. And people's coccyx do weird, like they're all so different. Like there's never any two coccyx or sacrums when you come around there that are the same. Some of them seem like they go on forever. Some will go and then do like an abrupt curve in. It's just, you never know. So I always kind of like make sure it looks like I've got their entire butt in there.
So the
Right,
CR
like
is
that.
on the ACES, but it's posterior.
You're definitely posterior, okay? So for the sacrum, it'll say center at ACES. I still, just in practice, I mean, technically it says at ACES, you know, 3 to 4 inches posterior, okay? For the coccyx, it will say 3 to 4 inches posterior and 2 inches below the ACES. That's probably a better, in reality, centering, because you're wanting to get both the sacrum and the coccyx, okay, on this lateral. So I always do go kind of the 2 inches below, so I make sure I get all of them. And you can see, like, we're definitely, you know, do we have the sacrum if we're all the way up here? Yeah. And again, it's the same kind of light situation. Okay, let me get, I don't have a 10 by 14. 12, okay, here we go, 12, all right. Okay, and again, your L, you know, either down here or up here up here is probably a good choice too, because we know that this is a little bit higher than your sacrum, so you're gonna be fine. If you want to do it right here, that's going to be fine too, because that's not going to be sacrum right there. Again, you know, you come down and curves around. So right in here is going to be flesh. Okay, not sacrum. All right, again, make sure you use the mat on all of these ones like this. Okay. Any questions on that? Okay, so that we just covered sacrum, coccyx, spot. lumbar. Okay. All right, nail on your back. And I will switch this up. All right, so you'll do the sacrum. So if it's a sacrum, what are we doing on our axial? Up for how many? No, for
15.
sacrum?
15.
Oh. SI joints? 30 would be correct. Okay. So 15.
I need to write my own.
Oh, sorry. There. Okay. So we're kind of, again, about 2 inches above pubic symphysis. You can also kind of use that as like, usually there's about, give or take, 4 inches between the pubic symphysis and your ACEs. So if we are 2 inches above pubic symphysis, where should we be from ACEs?
2 inches below.
That's a good way. Okay, because who wants to be? Nobody wants to do that. Some patients you might luck out and you can kind of see where that area is a little bit better than other patients, but most of the time not, all right? And definitely not with a guy. All right, so I always go from ACEs. About 2 inches below ACEs, you should be good, okay?
But you just said that's either or, right?
Yeah.
Okay.
Well, yeah.
Either 2 inches above the pubic symphysis or do 2 inches below the ACEs.
Yeah, that should get you in right around within an inch or so either way. Is that difference going to make a difference really in our picture? Yeah. Okay. So it will be much more comfortable for you guys going 2 inches below ACEs. Okay. But you can tell everyone I told you the correct way, right? And I told you the correct way. I did tell you the correct way. Now I'm telling you the way you're going to, the practical way, okay?
My clinical instructor said in the crotch.
Well, yeah, I mean, okay, well, look at our
If you forget.
person here, okay? This is where the SI joints are. Hey, technically, is that crotch? No, it's above crotch, okay? So we're above crotch. Crotch is like here, here's crotch, okay?
No, that was for the sacrum that,
Right. Okay, now we're SI joints, which is the sacrum. That's the top of the sacrum, okay? This is our sacrum right here. Nice
so
little
her crotch would
heart
be here,
shaped.
so you're shooting right.
Well,
It's
that's like right here, okay?
it is.
That's like the bottom of your feet. Okay, I can point to myself because it's me. Alright? Like, this is the crotch area. Right here is like my pubic symphysis. I'm feeling it right now. Okay.
I can't feel
You are
What I
feeling
do
it
for
right
my
now?
classes, okay? Now, if there were guys in here, I would not be doing this. This is why it's much better to have all ladies. Okay?
Yeah.
Alright, so that's
Yeah, I'm
below here, okay? That's like kind of right, this is right here. So that's sort of the bottom of our sacrum, if you want to look at it that way, right? Okay? So so if you make sure you have, well, but we're not going to be touching it,
Right.
right? We're going to be touching ACEs.
And if you do,
right
more
here,
power to you.
right? Right in here is where our ACEs sticks out. So
Two
that's
inches
kind of
below that.
about, well, this one is a little small person here. But it's about 4 inches, maybe 3.5, 4 inches. So we're
Our
going to be
random-
below. We're going to be
Our
still
random
right
person,
in
she was
right
like,
in
I had to feel
okay.
for pubic symphysis, so you guys have to do it. I was like,
So it's not, so crotch is, it's in that vicinity, yes, but we want to be, that's going to be like the bottom of your image, okay? So if you make sure the bottom of your light is at crotch, okay?
I was just telling you what one person said.
Okay, well,
Everybody
but
has
no,
their own-
you'll hear some instructors are more comfortable saying that word than others. Guy instructors are probably aren't going to tell women, I'm going to talk about a woman's crotch period no matter what. They're going to use all the technical right things. Okay, so anyway, the thing you want to be careful about on the sacrum images. Now what are we doing? We're angling up, so we're kind of throwing our picture up. What you need to be careful about is you don't cut off the top of your sacrum, because if you do just angle it or center around crotch, you're going to cut the top of your sacrum off. So if anything, you want to be a little higher, okay, when you're angling up for the sacrum. All right? Does that make sense? You get that? We're angling up, so it's throwing your image up a little bit. Okay, so you want to make sure that you don't chop off the top of your sacrum. Okay. All right. So, and especially since we know we don't need light, we don't want to like be irradiating as much, too many things. Okay, especially down in this area. Sorry. You want to make sure again that their hips aren't rotated, that we're centered. We're a little off center here now. Whoop. This table really flips. Okay, so I'm gonna come down a little bit because we don't know. If we have this much light up here, we have a lot more actually on the table, right? Okay. Well, probably actually not that much
The
more.
top of her, the sacrum is about, the top of it is almost the same as the edge.
Almost right, yeah. So if you want to feel like where the top of the crest is, then make sure you got enough light. So if anything, you can even be okay, right like that. Okay.
Okay.
All right. And really, we don't need like those joints are like right in here. So don't be really wide open on this one. Okay. Like this is the most wide that you want it open. Okay. Did we didn't even have, all right, this is sacrum, okay. Now if we were doing the axial to get the SI joints, it's almost the same as this. We're just gonna throw a steeper angle on. Okay, now we're way high. We're just gonna come back to where we just were. Okay, and hopefully this should be pretty close to lined up. Nope. It's a steeper angle, so make sure you don't forget that. Okay, it's gonna look like, whoa, this is like totally not gonna get it, but you are, okay? Just trust the lining it up works, okay? Okay, and that's your axial.
Okay.
Sorry. I was hungry too. Okay, so that's your SI joints, your axial SI joints. Looks just like the sacrum, except we got a steeper angle. Okay. All right. Now, okay, since we're right here, we're gonna go to which SI joint do we have? RPM. So that means right side is down, correct? Which left side is up, which that's nice for us on testing because that means we can control it. You don't really want, remember this is like just a 25 to 30 degree. So just have them come up right like that. And you shifted, didn't you? Just like that, okay? If you want to use the wedge, just don't put it under all the way. Just put it slightly under, okay? Just to give them a little support. Now we're coming from the upside ACES, right? And now remember, we just need to get the one joint. So I would want to come down. See, I always feel like if we're angling, it said at ACES, right?
And then
No.
And 1 inch
One inch
medial,
medial.
right? at ACEs to me seems high, because remember, like, well, I guess it is. Always feels to me like we're at the top of it. Okay, so if you want to come a little bit below that, just so you're more like in the middle of the SI joint, to me that just makes sense when you look at anatomy and where everything is. If you're going to go right at ACEs, just make sure that you don't collimate too tight, that you cut off the bottom of your SI joint, okay?
But wouldn't we be okay too if we brought it center at the crest?
Well, you don't want to
Brought it
center at
immediately?
the crest, because that's
Because
the
we'll
top.
definitely have it in there.
Right, but that's the top of it. So you're going to have that and all up here. Do we need to have all up here?
No.
Here's our SI joint right here. So we wouldn't want to center at the top of the crest. So ACEs is about right. And that's probably why they say center at ACEs, because it is, the most convenient, closest point to it. To me, a little bit below ACEs is more like perfectly centered. But like I said, if you're going to, use ACEs, that's fine. Just make sure you don't get so tight, and you probably aren't at this point, that you cut off, the bottom of your SI joint. You want to make sure you get the whole joint. Okay. Then the only other tricky thing you might, and definitely on this one, since we're doing that SI joint, do we really need to be over here, like have light on that side? No. So kind of collimate in like this, and you can shield over here. Okay, so over here, switch you can leave, if you want to leave a shield up here, that's fine. Just throw one over on this side too, little one if you have a little one. Okay, I would put marker right there, and this one I would put on a patient. I don't like to put markers on patients, but in this one I would, right over here. Okay. All right, makes sense. Same thing, and we just do the same thing on the other side. If you control everything real well, you don't have to touch the light, your collimation, you just slide it over and slightly bring your patient up on the other side, okay? All right. Now, all we have is Coccyx, right? Okay, so Coccyx, what are we doing with the Coccyx?
Angling down.
Down, how much?
10.
10. Again, we don't want to really touch pubic symphysis, so we're going to go about 2 inches below that ACEs. Now, Coccyx is really little. Again, now remember, since we were angling down, we're throwing it down. So while you think it might be perfectly fine to just bring the light to, like if you have a person that's got pants on like this, and you can exactly see where things are. You're probably gonna have a patient with a gown. Gowns are trickier for this stuff. Gowns are not fun for this, these particular ones, okay? Just because it is nice to have this reference of pants and things. So if you feel comfortable when they have a gown, or you can ask the patient to kind of like, bring the gown in between their legs, just so you can see the outline of their body a little better. Yeah. Okay? And you don't have to touch them, just ask them to do that. Okay? Does that make sense? Yeah. Okay? Just so you can see. Because on this one, you want to make sure you're a little bit below here. Okay? Because we're throwing it down. We're angling down, so that the light and everything's being thrown that way. So her anatomy is actually sliding that way. So what's gonna come out on your cassette is gonna be a little bit below that. Okay. Okay. And again, like the reason why I say always kind of start up with your cassette kind of in the middle where you are. So when we do angle down, we have to bring this down. You're not going to run out of table, okay? Because that's always a pain when you run out of table and you're like, oh crap. Okay, this way that stops all that from happening. Again, this one, Coccyx, is really tiny, so you're going to collimate a lot on this one. So the hardest thing on this one, again, is like, hurry up at the marker. Okay, since we're going down like this, you can stick it right up in this corner, okay? Or you can kind of probably stick it right there, but that's getting a little dicey. So up here is usually okay. All right, especially since we're going down that way. All right, any questions on anything? Make sense? Okay, now we have to practice because you know, check in.
Verify that. Okay, that sounds right.